The Alaska Native Tribal Health Consortium vision is that Alaska Native people are the healthiest people in the world. Each year, our work brings that vision within reach. Seeing more patients at the Alaska Native Medical Center means access to quality care is within reach for more of the Alaska Native people we serve. Building water systems for rural communities means health is within reach for families with the turn of a faucet. And through ANTHC's health prevention and education work, a healthier future is within reach for the next generation of Alaska Native people.
Before all that erosion, they used to travel anywhere, but now it's like a small island because of the erosion. Water, creeks are growing bigger.
The community of Newtok has been planning and hoping to move to higher, safer ground. With the move to Mertarvik, across the river, on higher ground on Nelson Island, they're able to get to that safer ground. And in this first pioneer phase, we have 21 homes and 21 families that have moved now from Newtok to Mertarvik, and all 21 homes are outfitted with a portable alternative sanitation system that allows the homeowner a safer way to clean and wash their hands and have potable water, as well as a different type of sanitation for the waste.
All the past system here in the new site, new home, it's exciting. You don't have to smell the odor. You don't have to go dump it out. And it's a good thing for us.
When I first heard about Jared's accident, my boy, I was in Anchorage.
Jared snuck out of the house with the Honda with his friends and got into a bad accident.
We bumped another person, and then I flew off, hit my head, and I don't remember anything else.
Jared sustained a severe traumatic brain injury. He underwent multiple operations and had to undergo extensive rehab. The community reached out and asked what could be done to help prevent this type of injury in the future.
The ANTHC Injury Prevention Partnership with Nuustuyaaq really began with many community discussions.
This really allowed the community to embrace the idea of safe ATV culture and own it for their own community.
With the community team and the school, we developed an ATV safety education.
We did training from the primary school, which is kindergarten through 5th grade. There was about 70 students involved with that. And then also we did a second training, which is the secondary or the 6th through 12th grade students, and there was about 50 students from there.
Additionally, we secured funds to provide helmets for all the children who went through the curriculum for ATV safety.
In the mornings, what we did is went to the clinic and did simulation education in the clinic with the health aides, where we trained for traumatic brain injury stabilization. We also were fortunate enough to do the Stop the Bleed program that we do here at ANTHC.
The American College of Surgeons, which is our credentialing body for our trauma verification, has a national movement to be able to enhance the level of care to patients that are bleeding, to be able to stop the bleeding in a timely manner in hopes of prolonging their expectancy. So the goal of this national campaign, Stop the Bleed, is to be able to enhance the quality of education for your average community member to be able to stop the bleeding in the event of an emergency. So we wanted to take it one step further, and we didn't just want to have a few people trained. Our goal is to be able to have all of Alaska and all of our tribal health organizations trained to be instructors so that they can go out and teach their community. We also just received a grant, a national grant, that will be going to 14 of our tribal health organizations in the next 4 to 5 months and teaching the Stop the Bleed instructor courses and also helping them to create their first community class.
The DHEP program is a great example of bringing health within reach. It's educating people from the communities who have ties to the communities who want to go back and work in their own homes.
Patients are seeing Alaska Native providers. They're building relationships and able to continue those relationships.
The most rewarding part for me in this job is to work alongside my people, and I think that's really important as we work together as a culture and as a community.
The DHAT program has grown significantly in the last 15 years. The first 3 classes of DHATs were sent halfway around the world to New Zealand. And then in 2007, ANTHC took on the challenge of training DHATs here in Alaska.
Our students now are enrolled at Ilisavik College in Utqiagvik. We don't actually go to Barrow for the education, but they get an associate degree. In June of 2019, we had our largest class graduating from the Alaska Dental Therapy Educational Program, and in that class we had 6 students from the lower 48. ANTHC has continued to provide really good leadership, giving us the tools we need to provide the best education possible, so we have the best providers out there.
Teletrauma is bringing the specialist to the patient at that moment. It's about providing the right care to the right person at the right time. But when you're able to see that patient on the other end and to see their work of breathing and to see what's going on with them, you're able to provide better evaluation and hopefully to improve clinical outcomes. This year, ANMC has partnered with Copper River Native Association, St. Paul and Eastern Aleutian to provide teletrauma in the most remote locations in Alaska. We're providing this level of care that surpasses the expectations of any other emergency department in the state. And we just received an award for our national credentialing body, which is BCEN, or Board Certified Emergency Nurses. We were recognized in the top 5 finalists in the nation for the most certified emergency nurses for a large health organization. We also improved our quality metrics from our left without being seen, which were less than 2%, which is a national metric. Our door-to-doctor times average around 24 minutes, and national goals are around 25.
I had both of my sons at ANMC. Our first son, Emery, was born on March 10th, 2017, and he was 7 pounds, 3 ounces, and 21 inches. Our second son, Ezra, was born on September 30th, 2019. And he was 8 pounds, 9 ounces, and 21¼ inches. Having your first kid is a little overwhelming. It can be overwhelming. So I wanted to feel like I was getting all the help that I needed. They made sure that I had everything I needed to care for him while I was in the hospital. And they also helped me make sure that I was ready to take care of him when I went home from ANMC.
Typically with the hospital institutions, they just tell you, hey, do this, take this, do this, do this. But they're very attentive to do you have any questions? This is what I need you to do and this is why. So stuff like that.
Well, and I think that kind of made us probably feel empowered, like we're taking care of our own health. I feel really lucky to be able to have my kids there and get treated there.
We grew up, in a big family, and we had our old Nana and stuff, so we have our values and our traditions and our culture. And one of the things is the care of your family, the treatment of your family. You treat people the way you want to be treated, and that's what you get here. It really is. It's what you get here right from the start. From the travel to getting in the shuttles, and then to the care that you get in the hospital. They care about you. And they treat you like they would treat their own parents or their own family. Every single person here, right from the start.